We're good.
Hey everyone. Sorry, we're having some technical difficulties, but we got some cool stuff as a result of it. We're doing some first time things and it always just slightly tweaks us, but then we're good. We're going to be talking today about why you should avoid quad exercises for knee pain. I have a really good talk with you here. I'm going to bring up some research studies as well that support this. And I'm giving you cutting edge information here. So this is going to be super helpful if you have knee osteoarthritis, patellofemoral pain syndrome, like pain in your kneecap, chondromalacia patella, which is a worse version of that. Also ACL problems and definitely meniscus tears, meniscus injuries. We've got a bunch of other things lined up for you today. Of course, we're going to be answering comments, taking some callers, but we have a special guest lined up for you. His name is Emmett Swint. He's one of our knee arthritis recovery program members. And we're going to bring him on live here, ask him a few questions. He might ask me a few questions as well. And you're going to get to see a really fun interaction with one of our program members. So before we get into that, let's hear where you guys are from. So please, we have comments already coming in. Please type in the chat what part of the world you're in, as specific or as unspecific as you want to be, the city, the state, the region, whatever you want. We just love to see where people are at. All over the world. We got Muhammad here from Turkey. Very cool. Turkey's in the house. Kimberly is here. She says, happy Tuesday, Dr. David and EPMPT. Kimberly's one of our regulars. Thanks for joining us again, Kimberly. We'll love to see the regulars here. MZN says, hello again, all. Mazen from Egypt. Oh my gosh, Turkey and Egypt. And then we have Kimberly here from the US. Cindy Castillo is here. She says, hi, Dr. David. Looking forward to your chat today. Very cool. We have Dora, who says, in serious pain. Oh no, just had 2 steroid shots, but legs are cramping and hurting. Diagnosis, collapsed knee joint. Oh, arthritis, imbalance in walk, limping. Okay, this is going to be super helpful for you today then. Today's more of like just to make sure you guys know, I'll be able to answer questions and help you out as always. But today's more like analytical, a little more sciencey. I'm happy to demonstrate any exercises as you guys ask questions. And of course, Dora, you might want to call in and see if I can help you out. That way we can make sure to point you guys in the right direction. But today's going to be definitely more analytical. Donna is over on Facebook. She says, hi, Dr. David from Alberta, Canada. So cool. Canada's checking in. Julie Parker's here. She says, is this live now, an hour early? Yes, Julie, we are a little bit early. So we got a few more things to fit in today. So we bumped it up a little early. So those of you guys that are regulars, adjust your calendars. And I understand if you can't make it. Dr. Lyons is here, also early. Hello, everyone from Los Angeles. So cool. Thanks for joining us, Dr. Lyons. Mina's here. She's becoming a regular now. Hey, Dr. David, I'm able to watch this live for the first time today. Yes. It's almost 1 a.m. here. I've got chondromalacia. It's improving, though I still struggle with stairs, long walks, and knee bending. Great. This is going to be a helpful topic for you today then. That's good, Mina. Glad you could join us. Thanks for joining us so early in the morning. Glory Ann says, Florida, USA. Very cool. We got Florida in here. Plenty says it's 7 a.m. in New Zealand. Good morning to you over in New Zealand, Plenty. New Jersey, that's where Joanne Maloney Hankard is from. Welcome from New Jersey. We've got the East Coast checking in. San Antonio, go Spurs. Oh yeah, they made it to the championship series. I'm rooting for them as well, being a fellow Texan. Thanks for joining us, Donna. Let's go Spurs. Nick's got a good team too, though. Satya says, Italy on board. Italy's in the house. Fantastic. Hello, everyone. And then we have New Jersey, South Jersey from, I'll just say Crow. That's going to be a hard one to pronounce. Mio says they're from Germany. Great. We got Europe here. Chesapeake, Virginia. That's where Carol Ann is from. Hey, Carol Ann. We have Brian from Atlanta. So cool. Dora says overseas Italy, formerly Las Cruces. Oh my gosh, you're just down the road from us, and now you're complete other side of the world. We got Carissa, who's also from New Zealand. A lot of New Zealanders today. That's so neat. Fantastic. And we have Linda from Arkansas, USA. Great. Well, thank you everyone for joining us. So we are going to get to the topic in just a moment, but first I want to bring on our guest, Mr. Emmett Swint. Hopefully he's ready to go here. And we're going to just chit chat. There's Emmett. Hey, Emmett. Can you hear me okay? Just give us a moment while we get the audio going here. Emmett, can you hear me? Oh, okay. Okay.
Okay.
I hear you now, Emmett. Okay,
All
now
right.
we're good.
Yeah, I had it on unmute.
Let me raise my volume here. I think I can hear you a little better now, Emmett. Thank you so much for joining us here. I appreciate you taking the time and sharing with our audience. We're going to hear about your story, hopefully a bit, and then also your biggest win overall since becoming a member of the knee arthritis recovery program. Of course, I want to answer any questions you have, anything specific. I want to be sure to help you out. And then, if you're willing, we'd love to have you maybe field a couple of questions from the community, people that are chatting in the comments here, if you guys have any questions for Emmett as he's coming along. So are you good with that, Emmett?
Yeah, sure. Fine.
Fantastic. Thank you. Well, if you could tell us a bit about how you got into the program, what's going on in your life that led you to us. If you could take a minute to share that, I'd love it.
All right. Well, first of all, I was probably in my working life before, was mainly like a desk job. So I did a lot of sitting, and I didn't realize the consequences later in life of just sitting so much and not being as very active that I could have been. I still enjoyed at that time hiking, tennis, although tennis didn't last very long with the knees, and square dancing, line dancing, and everything. And when I retired, I became very active in like a local senior center, which had a good number of movement programs that I was involved with. Played table tennis just about every day. But over time, the knees got worse. I had knee arthritis as a diagnosis, and most of that just kind of fell apart, you might say, and one by one just went by the board or so. And at any rate, and I went through, I think, medically the same as what so many people have done. You know, you get go in for knee pain. They give you pills pretty much to help reduce the inflammation. And then you go to the orthopedist who says, well, maybe not quite yet. We would want to do surgery. We'll try physical therapy first. That helped a little bit, but not long lasting. And I knew I didn't want to go and have surgery, even though many people have said it was the best thing they've ever done. I also heard a lot of people where they really had problems afterwards. And at 83, I didn't want to have to go through all of that. So I had found some of the videos from Dr. David online, and were doing those before I joined the program. It was very helpful, but I felt I needed a little more guidance in terms of how to structure the progress that you would make. And even in reviewing some of their materials, there was a case study where they went through exactly how she had gone through the program and had really good results. So I joined back in, I think, the end of July of 2025, and then and followed the program. And the program itself was broken down into different phases, and there were many different types of support that would help you in whatever phase you were in. You had videos that gave, for example, in phase 1, it was just mainly to help reduce the pain. And for that, there were different videos and different techniques that you can use to relieve
Yep.
that. One of them was offloading, which I was using a cane before, but I carried it a little bit farther than that. At the senior center, it was a very long distance sometimes where you parked to where you were going in. So by the time I got in the building, I was already worn out. So I was able to get like a temporary handicap sticker that I was much closer then, was able to park closer in. And I would keep in even a walker in the back of the car. And for those days where I knew I was going to have to walk a long distance, and that was what I wanted to use just to have available for me. And now I still use a cane, but it's mainly for support, not so much for relieving a lot of the pain and everything. Some of the other things. I'm sorry.
Can I pause you there for a second? I just have
Yeah,
a
sure.
quick question, Emmett.
Uh-huh.
I know you went to the senior center and all that. Maybe you were going to bring this up, but I just wanted to make sure I didn't miss it. You had gone to the doctor, they gave you pain medications, and you said they sent you to physical therapy.
Right.
Did they ever recommend that you have a knee replacement surgery?
Oh yeah. He said it was like bone on bone. It was moderate, I think they said. But he did recommend to have the surgery. And every time I would go to my primary physician, he would say, "Well, aren't you ready for your surgery yet?" And I said, "No." And I tried to explain to them the program, and it kind of went over the head a little bit.
Yeah. This is not normal
Well,
what we're doing here in this program.
They were happy that I was in it and doing it, and was wishing me good luck, so, but
Good.
I felt a little reluctance in terms of what they were feeling. But so that was pretty much it. Some of the other support within the program is each week there was like a group lesson that gave you more in-depth information about, getting progress throughout the program. There's also like community pages where you can share with others, and I've gotten a lot of good information from other people that had questions, and I knew it applied to me, but I wasn't probably going to ask about it or so.
Yes, I love that you brought that up, because I think that's one of the biggest benefits about being in a group. That's why the knee arthritis recovery program. We've modified it to where it's a group of people, and there's over 100 members in there currently right now. It keeps growing, and you don't always know what questions you have, but when you see other people post in the community or on those weekly group coaching calls, ask questions, then it starts to spark your interest. Just like here on this live stream that we do every week, I'm sure a lot of the viewers watching right now will hear a comment that I answer, or on the phone calls that we're doing, or now doing these calls like this with you, Emmett, where people will say, "Oh, wow, I never thought of that," or "I also went through that." Might give them some validation. So I've seen in our private community within the knee arthritis recovery program, so many people benefit, and so I'm glad you brought that up, that it benefited you. That's great.
Right. And another thing that was benefit in that particular part was being able to take a video of me doing the exercise, and then having the comments from the coaches as well. That brought up a lot of just adjustments that you need to make with the with the different exercises to make it be better, particular for you, because it's not just being treated as an average, but being treated as an individual person.
Yeah, we've customized it that way. Absolutely. Well, just to clarify a couple things here that I think the audience needs to wrap their heads around and understand. So you were talking about your story. You started going to the senior center. You were playing table tennis, you were being active, doing some dance classes, and did you hit a point where the knee pain was so bad that you were having trouble walking, having trouble doing regular activities?
Oh yeah, yeah. I mean, it was like I was fine with table tennis as long as they would hit the ball to me. But if I had to go from side to side, then then and it just got, all of the movement
Hmm.
activities pretty much went away. Like they did a lot of like line dancing and other, senior type strength, exercises as well.
Hmm.
I continued like with a seating elliptical at the gym for
Yeah.
exercise, but I realized probably when I was doing it, I was using the quads instead of the glutes, as you'll talk about. Uh,
Yeah.
and
You didn't know any different.
yeah, but when I joined the program, I knew nothing about glutes. I just thought it was a flabby piece of flesh on the back of your backside. But but now when you realize what their role is in terms of leg movement, body
Hmm.
movement in general, it really became quite a focus. And
Yes.
from that, I still do like gardening, and I lead a qigong class, which is similar to Tai Chi,
Yeah.
at the senior center, and do other things which I'm still moving. It's a lot easier now to
Hmm.
move, not long distances, but at least short distances with minimum pain at all, and sometimes no pain. So,
That's great. So since you joined the program and have been implementing, that was last July 2025, and currently we're at the beginning of June 2026, so almost a year, about 11 months.
yeah,
Would you say that you've had an improvement since then?
uh, definitely had an improvement. The really severe pain that I started out with, that got resolved fairly quickly with a lot
Hmm.
of the movements in part one, phase one, the knee swings
Yeah,
were
tillia swings.
helpful in terms of getting the joint movement a little better. Also, the offloading, of course, helped at the initial part of it, and
Yes.
and and then starting to do the exercises in both phase one and phase two, the glute activations, the toe curls, and the ab strengthening, the lower abs.
Hmm.
And that really helped. There's some days I have not as good as others, and there are other times where there's a pattern, like when pain may occur, but it's quickly resolved now, as
Yeah.
compared before when it would be like weeks on end when you would have it. So
So would you
it's
say that, would you say, Emmett, now that you have, now that it's been some time in the program, you've learned, you've gained strength, do you think that you're more confident in being able to handle the way your knee is moving and the pain that you, because you said you still get some pain, but would you say that you can
yeah.
control it better at this point?
Yeah, definitely can control more. It's like one thing you learn is not to overdo things as much. Like
Hmm.
if you feel like you're, beginning to have knee, not so much pain as much as just discomfort when walking
Yeah.
like at different stores, then don't go
Hmm.
to three or four stores all at once, just go to one or two. And so know
Hmm.
when to stop is one thing, is rather than trying to push yourself on.
Yeah.
Uh, and the other part would be, um, well, let's see, was, I guess, knowing when to stop, but also knowing what to do if it does happen, like, how to go back to the phase one and use the techniques there instead of just pushing and pushing and pushing with the other exercises. And the other part is the availability of the coaches to help you in terms of if you explain what you're doing, you get feedback. I just learned like last week in one of the breakthrough sessions that it was like my hip wasn't working exactly right. So I got exercises to work with the hip that would help with the mini squats, which were one of the big problems I've had in terms of always causing pain and not really squatting very much. Lots of grinding and creaking in the knees when I do it. But, so that
you got some clarity on how to do the exercise.
Helpful.
Great. Now, would you say at this point, Emmett, that your confidence in delaying, if not maybe even completely avoiding knee joint replacements has gone up since joining and implementing this program?
Oh yeah. I mean, I would not do it, and because I had like
awesome.
What it used to be a next door neighbor, her daughter just went through knee surgery, ended up having an infection, and they had to take out that knee and put in a temporary one and then give antibiotics for like 6 months. And then we'll have to go back and have a third surgery just to replace the permanent knee or so. So, things like that give you confidence to not want to do it.
Wow.
I mean, you hear of the stories, but when you actually know the people that it happens to, it's a different thing. Yeah.
That hits home. Absolutely. Yes. Well, thank you so much for sharing all that. I appreciate it. I'm sure the audience appreciates it. I want to give the people in the comments just a chance to, if you guys have any questions for Emmett here that he might answer, please start asking them. And then Emmett, if there's anything that I can answer for you, if you're stuck on something or have a question while we wait for some of the comments to come through, is there anything I can help you with? Do you feel like you're stuck somewhere?
There's one thing where I would like to know a little bit more about, at any rate, and that's like I can be walking fine, and then if I stop maybe to have conversation, or if I'm in the garden standing and watering the flowers and vegetables, then immediately the knees begin to stiffen up. And then when I start to walk back, I have to make sure I've got the cane there, because I really, for a short time, and then if I sit down for like 2 or 3 minutes and start walking back, I'm fine again. So it's that, standing and I guess the body weight that you're putting on, maybe on the knee itself or whatever, I'm not sure. But is there a way to stand or something else that would be helpful? I've actually went and bought one of these devices which you can sit on if you're having to stand for a long period of time, and then it breaks down and can be used as a cane after that. But the only thing about this is the seat in it is a little bit low, and so it's hard to get up. Hadn't got the strength yet to really get from a real low place unless I have something to prop my hands on to push off with.
Right. Yeah, and so that's where I was going with a thought on this is, is if you get that stiffness after you've been standing and walking for a while. I'm not sure how long it takes you to water everything, but just based on what you're telling me, and then with that combined with you having trouble getting up out of lower seats, it makes me think that your muscle imbalance is still affecting you. Obviously, it's improved since
Yeah.
you've felt better. However, if you continue to improve your glute strength, the butt muscle strength, then
Right.
it should translate to better use of your glute muscles while standing and walking, which then should take pressure off the knee joints so that they don't feel painful or stiff or uncomfortable the longer you're on your feet. Then that
Right.
glute strength should also allow you to get up out of lower places, like that stool that cane that is also a stool, so that you can more easily get up.
Right.
100%. The glute strength is. It sounds like it's the culprit here, and the
Yeah.
difficulty that you said you ran into at the beginning is people usually think that it's just a flabby piece of flesh, as you said back there. They don't understand the purpose, and you've come around and understood that. But I know you're one of our elder members. In other words, you're a little bit older than most other people in the community. Is my understanding? I maybe I'm wrong. You could be 50, and you're fooling me. But
No.
that just means that you've probably had more time to get weaker glutes the older
Yeah.
you are. I'm not saying this is an age problem. I actually staunchly disagree. I just think you've spent more time before you got to us to learn about how to strengthen your glutes, that your glutes got weaker during that time. And so you're just
Right.
working yourself out of a deeper hole, but you're making progress and it's working for you. So I think if you keep
Yeah.
going, you'll probably see improvements in standing
Yeah.
and getting up out of lower chairs.
Yeah. No, I feel a much better difference in terms of using the glutes and following the
Yeah.
types, like when you're walking, making sure that you're firing the glutes, the abs, and the toes
Yeah.
all at once. And that's very helpful because if I feel like I'm like having a little bit of pain in the knee when I'm walking, and I start that, that I'm focused on just that, it really helps quite a bit to at least
Yeah.
get to a place where I can, get away from it.
Mm-hmm. Yep. So I think as you get the glute strength up, which it just takes time, people don't become bodybuilders overnight.
Right.
And we don't need to shoot
Exactly.
for bodybuilder status with you, Emmett. As long as we just get enough strength to where your knees feel great, I think you'll be just fine. But the idea is strengthening can take months, even years, and
Yeah.
you're on the right track. Good
Yeah.
job.
Oh, thank you.
Well, let's see what comments we have here for Emmett. And Emmett, I'll read it out loud. Hopefully you can read it too, and then we'll let you answer it here. So Caroline Shipsey says, question for Emmett: will you stay in the program? Just putting you on the spot, Emmett.
Maybe he'll give me a discount. No, I definitely will stay for it. And the thing about it is, I'm also building up a lot of information that I can use in the, whether I would be in the program or not in the program, but just having like the breakthroughs and having the weekly chats, I'm always learning something new, and being able to go back and review a lot of those videos, you can get so much more information as well. So I plan to stay at least till I'm in the bodybuilding arena, I guess.
As long as it takes, pretty much. I love it. What question do we have next? We have Glorianne, who says, did you ever get back to an activity you did well before your issues walking, biking? Are you pain-free? So did you get back to activities that you did before,
Yeah.
and are you pain-free?
There are a few. Well, I do a little more of the gardening, than I was doing before. Of course, I'm modifying that by having to sit or be on my knees a lot as opposed to standing over and working standing up. But and I'm walking more, just smaller amounts, but without pain for a while. And I've and also doing a few more of the Tai Chi moves that I had not been doing, that I'd kind of given up just because, you know, it involved a lot of knee activity. And so, but I do look forward to doing some of the not so, at least the beginning type of movement classes that they have at the senior center.
Yeah.
Oh, and I do the elliptical now, but I'm able to use the glutes driving instead of the quads. And
Great.
so for cardio, I can do that, and I don't have any. In fact, it feels better after I do it. So
That's awesome. That's what I love to hear, Emmett. Hey, man, well, thank you so much for taking the time and answering some questions and sharing your story. I so greatly appreciate it. I'm sure everybody here watching this and people catching this on the replay will also benefit a lot from hearing where you're at. Thank you, Emmett. I appreciate you joining us. We'll see you next time, Emmett.
thank you.
Bye-bye. Fantastic. So, hey guys, before I get into the topic here for today, I want to let you know that our helpline is open. We'll flash our phone number here. So if you want to call and have me talk to you on the phone, answer a question or two, get you unstuck in fixing a knee pain problem or a hip pain problem, I'd love to be able to help you out. So the number there is 915-200-4159. So give us a call. Am I good to take this off? I had to have my headphones on to hear Emmett. So, and by the way, if you benefited from Emmett's talk there, him sharing his story, give us a thumbs up in the chat. Say something nice to Emmett or cheer on Emmett. I see Steven here says, hi, Emmett. We got people. We'll see some more comments come in here in a second. God bless you, Emmett there. That's from somebody else. Everybody just make Emmett feel good here. Caroline Shipley says, thank you, Emmett. Steven says we got more thank yous here. Fantastic. And if you join our knee arthritis recovery program, you can chat with Emmett in the community. We have a private community that's just for our members. Kimberly here says, nice to hear Emmett's testimony to Dr. David's teachings. And of course, you can chat with other people in the community. You know, they'll be able to help you out. It's a really good culture there. Like, people are super helpful. They like people like Emmett are there, basically. Emmett's such a nice guy. So just to give you an idea for what it's like. But let's get to the topic for today. So we're going to be talking about why you should avoid quad exercises for knee pain. This is critical because this highly goes against mainstream medicine when it comes to fixing knee problems. Because if you go to typical medical providers, your general medical providers out there, you're talking doctors, orthopedic doctors, your physical therapists, pretty much anyone that would deal with a knee pain problem. When it comes to recommending exercises, the reflexive knee-jerk reaction that they'll give you is start strengthening your quads. And what I'm going to present to you right now are 5 concepts and some research study to back up each one to show you and explain to you why you should not be using your quads and why there's other muscles that you should be focusing on instead. And what you have to realize as I talk about this is I'm going to give you the research studies. We'll put them in the description, so you could go find them and look them up and see for yourself where I'm finding this. But I encourage you to do more searches based on these research studies, because these aren't the only research studies out there. There are lots that are coming out. But what I always say, and I really think it's true, is when we talk about research for knee pain and knee conditions like knee arthritis, meniscus tears, those are probably like the more severe ones, although you can have a serious ACL injury or some really bad chondromalacia patella. most research is focused on surgical procedures, not rehabilitating knee problems without surgery. And so just make sure you pay attention to when you're looking at research studies on what's out there. And as a result of that, I think that when it comes to fixing knee problems without surgery, there's a lot of confusion. There's a lot of people that contradict each other. And what you have to do is try things out for yourself and make sure you can make sense of it. If it's not simple and straightforward to understand, and if it doesn't benefit you, it's probably not good for you. But you've got to make your own decision. So I'm here to present some information for you to help you make that decision. Let me just get into my notes here. I'm going to draw you a picture for number one. But just to give you the idea here is the forces. This is the idea that I want you to get. Forces at the knee joint, they increase with more quad strength. I'll just write STR for strength. Let me make that a little neater. The forces at your knee joint will increase the more quad strength you have and the more bending your knee when you're using your quads. And so what I mean by this, let me just draw you a picture. So, and I'll use the knee model here in a second too. Let's say that's your thigh bone, the side view of your thigh bone. And then here's the side view of your shin bone, your lower leg bone. And then your kneecap is right here on the front of your knee. Then you've got some muscles or a group of muscles called the quad muscles that run right here on the front of the thigh, and they come in and attach to your kneecap. And then you've got a tendon that connects from the bottom of the kneecap down to the front of the shin bone. That's the general structure of the side view of the knee, kneecap, femur or thigh bone, tibia or shin bone. And what you have to realize here is when the quad contracts, this is your quad muscle, the muscle on the front of your thigh, because of the angle of pull and because that kneecap lives within it's between the tendon down here and the muscle up here. When that muscle tightens up, and if it's stronger, it's going to push the kneecap directly against the thigh bone right there. And then when this muscle pulls, it also increases the tension down here, which pulls the shin bone up into the thigh bone. This right here is the crux. It's what I'm talking about whenever I talk about why there's a muscle imbalance present. And there's a study, let me get you it's a meta-analysis, and it was done, I don't have the name here, but the name of it is called, I don't have the name of the author, but the name of the study, and it's in the description, is May the Force Be With You, Star Wars themed, understanding how patellofemoral joint reaction force compares across different activities and physical interventions. And the main part of this study is they actually calculated forces. They built I think this is the one where they built a model. Oh no, that was the next one. They used math and physics and all that to figure out the forces within the joint to find out the obvious. Basically, whenever you increase strength here in the quad muscle, it increases these forces. But the other layer they put on is if you bend the knee more, let me show you on the model. So here's the same model right there. It's kind of bent that much. But if you bend the knee even more and you're trying to straighten out your knee here by using the quad muscles, it increases the forces between the thigh bone and the shin bone, and it increases the forces between the kneecap and the thigh bone. Pretty obvious, makes sense at face value, right? If this is so simple, then why are so many healthcare professionals out there giving advice to people with knee pain to strengthen their quads? It's contradictory. I recognize that. But you have to test it for yourself. And so let's talk about another study here that will help you piece this together, because what you have to realize when you're looking at research studies too is research studies generally answer one question per study. So when you ask the question of how do I fix knee arthritis, there isn't a study out there that just directly answers that question, because you have to break it into a bunch of little questions like, well, what do the quads do? What do the glutes do? What does the foot do? What about the angles and forces inside the joint? There's so many things. Does walking help it? Does hamstring exercise help? There's all these sub questions that come out, and research studies are just answering those little bits of questions, and we don't have enough complete data that's consistent to answer the direct question of how do we fix patellofemoral pain syndrome without surgery, or how do we fix a meniscus tear without surgery. We don't have that. We have all these little studies that we have to piece together, and I think they're incomplete. We don't have good solid data just yet. So then here for the next study, what they determined, and I think this was a meta-analysis. You guys have to double check the study, but that quad strength or increased quad tension, because whenever you tighten the muscle of the quads, I'm talking about the front of the thigh. I'll show you my leg here in a second. Increased quad tension obviously means you're going to get an increase. Increased quad tension equals an increase in pressure to the meniscus. Sorry for my handwriting. The knee cartilage. So we're talking about like the cartilage on the end of the thigh bone, on the back of the kneecap, and then the meniscus sits between the thigh bone and the shin bone. And even the ACL and other ligaments, other ligs, they all get more pressure or tension because you tension the ACL whenever you use more quad tension. So let me just show you a picture of what I mean over here on my thigh, and I think it'll make sense to you guys. So here are the quad muscles right here. Draw them in red. So I have like the vastus medialis, and then we have the vastus lateralis. There's 4 muscles. That's why they call it the quads. And then in the middle, you have the rectus femoris, which goes up to the hip. And then below the rectus femoris is another muscle called the vastus intermedialis. But they all converge. They all come together on the kneecap. And they're big muscles on the front of your thigh. There's a kneecap right there. And then it goes, you can see my tendon right there pop up. And it attaches to my shin bone right there. So when I use my quad muscles here, when I tighten these muscles, it yanks my kneecap and pulls my shin bone up into my thigh bone, and it just compresses everything in there. And we have research showing that it's not just the meniscus that gets compressed, it's the cartilage on the thigh bone and the cartilage on the back of the kneecap. The ACL gets tension too, which starts to raise the question in my mind of, are ACL tears set up by over-dominant quads? Which I definitely think so. I've made videos about that, but this research study just feeds into that. And there's a bunch of other structures that weren't even mentioned in the study. Like I talk about the saphenous nerve getting involved as well. You can compress nerves whenever you have an over-dominant muscle. But the idea with this study, the second idea that I'm trying to back up with research is that more quad tension directly compresses individual structures in the joint. Cartilage, meniscus, ligaments, all of it gets more compressed or tensioned if it's a ligament. Ligaments get tensioned. Cartilage gets compressed. And just to tell you more about that, when the knee is bent here, so here's the kneecap right there in the front. When the knee is bent, you can see it in this model here. It starts to pull this kneecap against the thigh bone. And then inside the knee joint, you can see deep in there, the ACL, that's that structure that's right there, runs, I'm touching on my pinky, running up and down. And then behind it, you can see something else on this side over here. That's the PCL. And then here's the LCL and the MCL, the medial collateral, lateral collateral ligaments. And these are the ones that famously tear in sports injuries, the ACL. And then of course your meniscus is right here. I'm wiggling it. So whenever you have increased compression from those quads, the entire joint gets compressed. And the reason why the ACL gets tension is because the force from this ligament right here. Let me bring it closer. The force in this ligament right here, it creates a shear force where it pulls the shin bone forward, which tensions that ACL on the inside, because it's trying to prevent, the ACL is preventing this forward force from the quads yanking on it. So biomechanically, this concept that I'm sharing is sound. There's beginning to be research about this idea, but it's still not adopted by the mainstream medical field as you guys see it, because you will get reflexive exercises given to you guys of, oh, you have a knee problem, it's quad strength. And I really think that the history behind that is whenever surgeries are done, because remember I said earlier that most research studies out there have to do with surgical procedures like ACL reconstructions, meniscus surgeries, knee replacement surgeries. After surgery, you have your quads shut down because they usually do a nerve block where let me show you on the model here. Because if they're going to open up your knee joint here to fix an ACL, to do something to your meniscus, if they have to open it up all the way to do a knee replacement, what the doctor's doing is they say, well, these big muscles up here, what if they flinch mid-surgery? People move while they're under anesthesia. They pick up their legs. I've been in surgery and I saw somebody look like a zombie, like they're coming alive. And so the surgeons are trying to prevent any movement from happening while they have you opened up and they're doing their thing in there. So what they do is they put medication into your thigh and where the nerves are, and they block the nerves so that this muscle it doesn't work. Then that sets up your knee joint to be operated on without interference from these muscles. But after they close you up and the surgery's done, this muscle's recovering from the anesthesia, from the nerve block, and it doesn't work very well. So it makes sense to then focus on quad exercises right after surgery. But if you have not had surgery and you're trying to fix a knee problem, why are you focusing on quad strength if you're already quad dominant? So that's where I think the thinking comes. There's no like clear place I can tell you. That's just my best guess as an expert on why you would have people recommending quad strengthening. It's just a carryover from post-operative care, because most physical therapists out there are excellent at helping people recover from surgery, but not so great at helping people avoid surgery. But everybody with knee pain, post-surgical or not, end up going to general physical therapists for rehabilitation afterwards. All right, let's get to number 3 here to connect it. We have 5 points here. So let's talk about glute weakness, because there are studies coming out. When I say glutes, I'm talking about the butt muscles, but there's some caveats that I want to walk you guys through if you're looking at this research. So glute weakness, we've found, is equal to worse, let me spell correctly, worse knee osteoarthritis. And it's not just that, it's like also patellofemoral pain syndrome. I didn't highlight any studies, chondromalacia patella, meniscus tears. They're starting to connect glute weakness in some of these research studies to worse knee problems. And what the reason that I see this is it's because of the knee falling in. This is what they're watching. This is what the researchers are looking at. So when they see somebody with glute weakness, they'll look at somebody's leg and they'll see that their knees tend to fall in. They have an increased association with knee valgus. That's what this is called, where the knee goes in, and that makes somebody susceptible to like an ACL tear and other knee problems. And it makes sense, because when you see somebody's knees and their knees are like this, it just doesn't look right. Their knees should be straight up and down, more like this. That's going to be more proper alignment for the knees. But not all medical professionals are looking at this as, what does the alignment look like, especially like your general doctors that aren't treating knee pain on a consistent basis. As a result of the knee coming in, when they're looking at hip strength, they're looking at what they call in the research hip abductors, which are muscles on the side of your hip. And this is where I have the caveat that I want to share, because I tell people, do not strengthen your hip abductors, the muscles that make your leg move to the side. So let me show you what I mean here. The hip abductors, if you were to strengthen them, it would mean you move your leg in this direction. You do sideways motions, or sometimes you see people doing sidestepping. They'll put a band around their knees. They'll do sidestepping exercises, and they're doing these exercises with the intent of strengthening the hip abductors, abductors, because they're following the research that shows that glute weakness, specifically hip abductors, which some of those are glute muscles, they're associated with worse osteoarthritis. Where I have some tension about this is that the hip abductors, there's a group of muscles that move your leg out to the side. The ones that are relatively, let me show you on the side here. All these are the side hip muscles. Some of them are more on the back half of the hip. Some of them are more on the front half of the hip. And in the research, they don't really delineate too much which ones are which. Plus, it's hard for you to identify, I'm only firing the gluteus medius or the gluteus maximus or the gluteus minimus or the TFL. There's all these muscles in here, and you can't really say I'm going to isolate one. They just say work them all out. Move them this way, and you'll work them all out. The thing is, you can have an imbalance between the muscles that are relatively on the front and the muscles that are relatively in the back. And in fact, that's what we often see is when people do sideways exercises like this, where they're moving their leg out to the side, they're using more so the muscles right here, like where my front pocket is. And right under my front pocket is a muscle called the TFL, tensor fascia lata. And that muscle is a hip abductor. It does move your leg out to the side, but it can also help in hip flexion and hip internal rotation, which now starts to wake up the quad muscles and other hip flexor muscles. What I mean by all this is if you're using the hip abductor muscles as the research tells you to, because they found that weak glutes, weak hip abductors cause worse knee osteoarthritis. If you're using those front side hip muscles, like the TFL, then you're more likely to increase usage of your quads, which then sets you up for increased pressure in your knee joint. So what I tell people instead, and I can't find research on this, if you guys find some, please drop it in the comments. I would love to see it. What I say instead is go directly to just hip extension. In other words, move your leg backwards. Let me show you what I mean by that. Instead of moving your leg out to the side, I don't like that because you can use the front hip muscles, which make you want to use your quads, which worsen knee tension. You need to do exercises that make you go backwards like this. And then when you think of the practicality of it, when you walk, you use these muscles. You're moving your leg backwards to push yourself off and go forward. And you don't really do a whole lot of sideways motion. So it just makes sense, practically speaking, to strengthen the backside of the muscles. But I'm not just saying this as a theory. We have a whole program, many programs actually, but the knee arthritis recovery program is built on this principle of let's focus on hip extension, glute maximus exercises more so, rather than sideways motions, hip abduction. And we have tons of people that have been through it, like Emmett, who you saw today on this very video. I teach them the same concept, and they have improvements as a result of this. And like Emmett said, he can be walking and then just turn on the glutes, like I talk about with glute walking all the time. And it can instantaneously reduce pain for a lot of people. For most people, though, it'll give them more gradual pain relief, but it's long lasting because it's fixing the forces at the knee. It's reducing the quad tension. And this is what helps people recover from knee pain. All right, we have a call. We're going to talk to Rekha from Chicago, who's got a knee problem. Rekha, this is Dr. David. Are you there?
Yeah, hi, Dr. David.
Oh, one second. I can't hear you.
To hear from you.
Hi, Rekha. Nice to meet you.
Yeah, nice to see you. Yes, yeah, I'm just so happy that I started your program.
Oh, great.
I'm so happy. Yes.
You actually signed up and joined our membership?
Yes, I did.
Well,
I'm your
welcome.
member for a long time. Yes. I mean, I just started, but I paid for a long time. So
Thank you
I
for
did that for a
joining.
long time.
That's
Yes.
fantastic. Well,
Okay.
we'll be seeing you on the in the group and on the weekly group coaching calls. So I'm excited about
Oh,
that.
yeah. I do attend them, and yes, the other coaches do see me.
Oh,
Yes.
great.
Yes.
Well, how can I help you, Rika?
Okay. So, I went so fast from phase 1 to phase 2.
Great.
And at that time, I was so happy that, oh my God, I'm going to go from phase 2 to phase 3 in no time. But now I'm stuck at phase 2. The problem is when I do those ab curls,
Yes.
after finishing them, I get pain on the inner side of my left leg because left leg is the one which is in the problem.
Got it. Okay.
Yeah.
Is it
And,
closer to your
I mean,
knee or closer to your hip or right in the middle between the two?
no, right on the knee.
Okay.
On the knee.
Got it. Okay. I think this is pretty straightforward. Let me tell you what the most common problem is when doing ab work and you get knee pain. And I'll show you. Hopefully you can see me on video. But let me just explain and then I'll show you. So when you're doing an ab exercise, and I'll show you, I think you're doing an ab curl, right? Is it the one with your knees bent or the one with your knees straight?
No, I do my knee straight.
Got it. Okay. So when your knees are down, so that means that you should be flattening your back and you're targeting your lower abs, but you're doing the advanced version. You might need to back off to the more basic version with your knees bent, because then you can better target your abs and you're less likely to use your thigh muscles. One of the main reasons people get inner knee pain on an ab exercise is because they're trying to squeeze their legs together or they're moving their legs in an inappropriate way. And the way I teach this exercise, let me show you here on the video so you can see me. I'll tell people lie flat. Then the key thing is to look at your feet and you want to turn your toes out, because when you do that, it turns on the back of your hip, the glutes. Then not only turn your toes out, but you're going to dig your heels down. That really activates the glutes. And when you have the glutes active, you're less likely to use the thigh muscles. Now, just be careful that you're not being too aggressive with the glutes. You just want them to kind of go like 20 to 30%. Just get them to turn on, not be super aggressive with it. Then once the glutes are active, push your back flat. That activates the abs, and then you're coming up and doing the ab curl where you're holding. This should shut this down. Go ahead.
Yes, because I do my, the toes, I do it on the sides and on the heels on the floor also. But I think I'm squeezing my glutes really hard.
Yes. Yeah. That sets up co-contraction. So where everything starts to fire, and that can start to cause your inner thigh muscles to activate and irritate that knee joint. So just be a little more gentle with that exercise, and I think you'll get it.
I see. Got it. Thank you so much.
Yeah.
And my another
good question.
problem is, second question is, like, I do all the exercise in a row,
Yeah.
And after I do all the exercises, besides these ab curls, I feel so good. And at the end, I do my heel raises.
Yes.
After just doing 10 heel raises, it again starts giving me the knee pain. And then I thought that maybe I should just do it because I'm already feeling good with the rest of the other exercises. But then you mentioned that, this heel raises strengthens your calves. So I just want to do it.
Yeah. If you're feeling pretty good with the other exercises, I would continue to get improvements there, and I wouldn't be disappointed if you held off on the calf exercises until a little bit later, until you stop getting improvements. If you're improving with 2 or 3 exercises, don't add the 4th in. You're getting some good momentum there. Bring in the calf raises later on when you feel like you're getting diminishing returns, or basically you're not improving that much more anymore with the current exercises. That's how this program's built. Is there the exercises change over time depending on the phase you're in, based on the improvements that you're making. So I'd be okay with you holding off on the calf raises. That's fine.
Okay.
Great questions, Rika. I love it.
Oh, thank you so much. I really appreciate Dr. David.
Yeah.
So for the legs, I just only do the just the toe crunches and the arch activation?
Hopefully you're doing some sort of glute exercise as well. That, I mean, if you feel like your glutes are working pretty well, then you might need to be focusing on the arch raises for your feet and the ab exercise. It just really depends on your situation. So this is a situation where you might need to talk with one of the coaches on a breakthrough session to get fine tuning, or post in the community and see the coaches will respond there too, or you might get community members helping you out as well. But usually what I recommend in the program is find 1, 2, maximum 3 things you should be doing on a consistent basis right now, and just work on those. There's a lot of things you could be doing. You could probably be doing 7 or 8 or more, but don't do them all. That might be too much for you.
Okay, got it.
Yeah.
Okay.
Great.
Okay.
Well, thank you so much.
Dr. David.
Absolutely, Rekha.
Thank you.
Of course.
See you again.
Thank you. See you in the program. Bye-bye.
Bye.
Great questions from program members today. We got Emmett as a live guest on video, and then Rekha calling in as well. So fantastic. Thank you, members, for showing up here on the call. And I'm sure you guys are in the chat too. If you are, say hello. Say, I'm a member. I love that. Raise your hand or something. Let's see. Speaking of the comments here, let's see who's in here. What questions have we got so far? We haven't come back since Emmett was asking. People were asking Emmett questions. So we have Glorianne says the point of view isn't really in mainstream orthopedics. That point of view, no, it's not. No, they go straight to the quads. And like I said, I think it's very driven because of the post-surgical rehabilitation research, which is taking into consideration that they've just shut down your quads on purpose to do surgery. Then, yeah, go strengthen your quads. But if you haven't had surgery, you probably have very active quads, so we don't need to be strengthening them more, because then you're just going to compress your poor knee joint. I love it. You're getting it. Mighty Jay-Z says, how would you recommend telling my PT to change the current approach to my therapy to be more in line with your philosophy? Oh, that is the $1 million question, Mighty. I mean, it's tough because you're potentially stepping on their toes, because they're the professional, or they're supposed to be the professional. They have the degree, and you might not be a specialist in that field. My best advice is you have to determine what kind of rapport you have with your therapist. Are they open? Do you feel like you can have that conversation with them without it destroying your relationship and getting kicked out of treatment with them? Maybe you do need to change therapists because you detect that it's not somebody you want to be working with long term. I've had some people that just say they just don't do the exercises that hurt them, and they'll just tell the therapist, this exercise hurts my knee. I would like to not do it. They'll be nice about it, obviously. And then we have some people that love to debate their therapists, and even at the expense of that relationship, we hear about those two guys. Just please be careful. And I don't want to cause any beef with any medical professionals. I truly believe they're all doing the best they can with what they know. But some of them do need to grow in what they know. Good comment there. Caroline says, I'm a member, just joined a few days ago. Welcome, Caroline. Breathing Space says, I'm a member. Hi, team. Hey, I see you. I love it. Our members are showing up here. What's a quick tip to shift our program focus off quads and more towards glutes while walking? Oh, that's tough. I don't think it's quick. Let me be more clear here. Some people get it quickly, but I would say most don't. I'd say from my experience, it's been about a third of people will get it pretty quick, how to use their glutes when they walk. And then 2/3 need a little more time. And the first obstacle we have to clear is, can you even fire your glutes? Like just seated or standing. Can you consciously tighten your glutes? And then after that, can you tighten your glutes apart from your thighs? That might take you a while to figure out. Some of you guys are doing it right now, and you're like, oh yeah, easy, I could do that. Then comes, can you fire your glutes apart from each other, left to right? Like, can you just tighten your right and just tighten your left without both sides kicking in at the same time? Then after that comes, All right, now practice it while you're walking. And every time you take a step, when you load on your right foot, right glute needs to kick in a little, and then the left glute kicks in a little when you load on that left side, and you're just alternating glute contraction. So there isn't a quick tip. There is no cheating on this. You just have to go through it. It's like learning to read. As a kid, you spend all of elementary school, 5 years, at least in the US here, 1st through 5th grade, and the focus is on improving from sounding out letters all the way to reading chapter books. It's a progression, guys, and you need to just go through it. And if you can't fire your glutes today, just understand you might be in 1st grade, and you have to work your way through all the grades to where you're running with your glutes potentially, or at least walking with your glutes. Good question there. Carrie Steves in Facebook says, "Hi there. Not sure if this question has been asked. Just joined. I'm having a hard time not engaging my quads when doing glute exercises. Any suggestions?" Yeah, that was just right off of what we're talking about. The main suggestion that I would recommend, let me show you over here, is get in the position that is most comfortable for you to tighten your glutes in. Very often it's sitting down like this. It might be standing up for you. It might even be lying down, like lie down on your back. Some people even lying down, face down. It'll work better for them. But if you think about tightening your glutes, what position works better, even if your thighs come on? Then once you find it, let's just say it's sitting for me, and if my thighs are kicking in too, then what you have to do is play with the percentages at which you tighten your glutes. Said differently, if you're tightening 100% back here in the glutes and the thighs come on, back it down to 50%. Can you tighten up slowly to 50% and feel if your thighs are coming on? Find the right percentage where you're below thigh muscles activating. And Carrie, it might be as low as 1%. I literally have had somebody every quarter or so, a few people a year that will say, I have to put my hands back here to feel my muscles, and I have to think really hard. It's more thinking than anything. You're not going to get a big workout on this exercise. The point isn't to get a workout. It's just to get your brain to connect to your butt muscles and for you to have a good, consistent control over what's going on between your legs and your hips. Then once you can fire it at 1% or 10%, you can work your way up to 20% and 50%, eventually get into the 80s, 90s. After you can do that, then I would practice it in standing and lying down and then transition it over to walking. But it's a matter of control. It's like playing an instrument. Those of you guys that have you ever learned an instrument? When you start my kids are learning piano right now, and they got that Simply Piano app, and it starts just push C, put your hand here, then C, D, E, and play these same over again. And before you know it, they're doing chords and they're playing songs. That's the process with glute activation. You have to start with just tightening the glutes at 1% and work your way up. Hope that helps you out, Carrie.
This is a response to somebody else, but if you can comment on it.
Yeah, okay. We got a response to somebody else. Exactly. Mine is so focused on strengthening my quads. Oh, we're talking about the PTs. Even after I mention it hurts. Response is, well, I got to focus on strengthening your knees. Yeah. That to me, so if you try talking to your therapist who wants to strengthen your quads and they're telling you to just keep going, because that's the therapist that has the no pain, no gain mentality. And where I stand on that is if you're increasing that quad tension, you're increasing the forces in your knee, it's only going to feed into the muscle imbalance. I might leave that place. Because if you think about it, if you go try to have that discussion with that therapist and you want to show them my channel, I don't have anything to hide. You can show them our channel. And we have so many medical professionals that come into our programs, doctors, PTs too, because they understand. Once they hear this explanation, they're like, oh, that makes sense. I got to go learn that. And it helps them and helps their patients potentially. But if they're not open to learning this, then why argue with somebody who's got their mind made up? I would probably go look for somebody else or consider joining our program if it's right for you. That's my best advice in that situation. Another one here. This is Kim. She says, can you advise on any massage gun techniques for slight pain and swelling in the knee, please? And then she says, only slight pain. A physio suggested circular massage around the knee. Okay. Yeah, let me grab my massage gun and I'll walk you through this real quick, Kim. So I got a massage gun. I just turned it on here on the lowest setting. And here's my recommendation. Oh, nice. I have the muscles already all drawn. So when you have pain in the knee and swelling in the knee joint, my stance on it is that if you have increased strength here, increased use dominance of the quad muscles, it's consistently putting too much pressure on your knee joint. And so what needs to happen up here in the thigh is we need to relax this muscle. And using the massage gun is a great way to do it. I would not be massaging around the knee joint with this tool because it's not going to feel comfortable. You could get in here with your hand and move things around, but I still don't think that's nearly as productive as putting this pulsating massage gun on your thigh muscles. Just relax your leg, whatever position you want to be in. You can have the legs straight or slightly bent, whatever's comfortable. And then what I like to do is run up and down. I'll kind of make, let me draw it. Could you toss me that black marker, please? Thanks. I'll make passes like this. I'll go up and down the leg, and I might go higher, but this is a G-rated show, maybe PG now. But I'll go up and down, and I'm applying some pressure as I go up this pathway. And if I find a spot where I'm like, ooh, that one's tender, let me just mark it as tender for you here. Let's say this spot right here is tender. I will then keep the massage gun on there. I might turn up the intensity if that's an option for you. You can also angle the gun in different spots. Notice I'm just keeping it right on that same spot, that X. And I can apply more pressure with my other hand, just make sure the gun's still working. This one's a little not as powerful as some other guns. So the motor I might overcome the motor. But you don't have to press super hard here. The idea is if you just maintain some pressure, work some different angles, after 30 to 60 seconds, half a minute to a minute, you should find that spot is less tender. Then you just keep moving on. And maybe you'll find another spot and you do the same thing. Work different angles, find the tender spot, the tender angle, the tender amount of pressure, and then just wait 30 to 60 seconds there. You can wiggle it this way. You can go circles if you want. There isn't any magic to it. It's just a matter of tenderizing that tender spot. Because when you free it up, let's say I find another one here, when you free up that spot, what's happened is the muscles tensioned up here and you let it give up. And when you give up some of that tension, like right where this X is, it translates to less force going through the knee joint. It reduces the forces through the knee if you can get that quad tension to go down using the massage gun. Hope that makes sense to you, Kim. Breathing Space says, hi, Dr. David, can you please demonstrate the standing donkey kick? The clamshells are really great, but they start to aggravate my hip flexor. I can't really feel my gluteus medius in the donkey kick. Yeah, I can demonstrate that for you for sure. And then Breathing Space, if you can just, one thing I want to make sure that you have in your head is gluteus medius is thrown out there a lot. I don't know if I'm really targeting my gluteus medius or not. All we want to do is make sure you're moving your leg in relative hip extension. If you're doing that and feeling this general area work and burn, you're on track, whether it's gluteus medius, gluteus maximus, the deep rotators, you have the P-go-go-Q muscles, piriformis, gemellus, and obturator muscles. So for the donkey kick, I like two versions. I like this version. I'll show you a standing version as well. You're going to be on all fours. You can be on your fists here. Doesn't matter. Then what you have to do, I like to tighten my abs. That way it's going to keep my back steady. And then I'll think about picking up a leg and going straight backwards relative to my body. So I'm bringing my foot up towards the ceiling. And then what I'll also do is I'll angle my knee out. So this is where it turns into the fire hydrant. They call it a fire hydrant because if you think of what a dog does at a fire hydrant. And then turn your foot outwards too. I'll keep my knee bent a little bit. And if you're doing it just like this, you should already start feeling something in the back of your hip burning. Now, notice what I didn't do is make my foot go as high as possible at the expense of my back arching, because now it becomes a back exercise. I don't want to exercise my back up here. I want to exercise my glute right here. So if I keep my back steady and just bring my foot up like this, I can focus on my glute. hold it for 10 seconds. That's usually the best place to start. You can alternate sides. Just make sure you come straight up, angle the knee out, turn the foot out, feel it in the glute. Don't overarch your back. You can suck in your abs to avoid overarching your back. That's the best way that I would do it in kneeling. Some people have trouble kneeling. So what you could do in standing, actually, let me use a walker. You don't need a walker. You just need like a table, a countertop, a sturdy chair, some piece of furniture that you can rely on that's sturdy. You need to be able to just lean over a bit. And then you're just going to do the same exact motion with your legs. So I'm going to move my leg directly backwards, angle my knee out, the fire hydrant part, and then turn my toe out. And you'll be surprised that little toe out motion just turns on the glute a little bit more and gets you that extra 5% of burn that makes a difference on this exercise. And then you just hold it in there, make sure you suck in those tummy muscles so that you don't overarch your back. And then do the same thing on the other side. Hope that helps out, breathing space. She said, I've shown my chiro and my primary, both are now looking at your program. They totally got it when I started explaining it. I could see the light bulb go off like they'd never thought of it that way. Yes, that happens all the time. Like what you guys all have to realize, I'm so glad you commented this, breathing space, is most medical professionals learn something in school, didn't question it, and are just regurgitating it to you in your healthcare visits. Unquestioningly. I saw it happen in school. I'm just that kind of guy, I guess. I questioned everything. I said, why do we have to do that? And I got taught just like everybody else did, but I always had questions. And it's led me to this point, and it's been so effective. And then when I teach other healthcare professionals, or like breathing space here, they showed their chiropractor and their primary, their PCP, it makes sense. It's just biomechanically sound. And then when you try it yourself and you get the benefits of less pain and avoiding surgery, it just seals the deal. So those of you guys that are watching right now saying, I'll try it tomorrow, I'll try it later. Come on, get going on this. You're just wasting time. Let's get moving. All right, so thanks for all those comments, everybody. Breathing space, I loved it. See you in the program, breathing space. All right, what's next here? We're going to talk through the rest of this list that I have for you guys here. So we talked about some studies that are backing up these concepts that I have. The first one is the forces of the knee increase when quad strength goes up, when you use your quads more, and when you bend the knee more. That's why like squats can hurt the deeper you go, because it's bending your knee more and it's increasing the quad strength. Increased quad tension equals increased pressure on the meniscus, the cartilage, the ACL, all the other ligaments as well. And then the third one that I covered was glute weakness equals worse knee osteoarthritis. And these are from studies. I'm not going to go into the detail of like the names and all that. They're linked in the description below. So I've cited who I'm talking from. Number 4, we're going to talk about a randomized controlled trial, which is a study done on a group of people where people didn't know what kind of treatment they were getting, where they were looking at knee arthritis treatments, and they did glute strength exercises. So I'm going to write glutes plus quad exercises, and they tested some people doing this workout routine versus quads only. What do you think happened, guys? What happened as a result of everybody had knee arthritis, but one group got glute exercises and quad exercises, and the other group got quad exercises only. Let me read you the name of the study. It's called The Effect of Hip Abductor Strengthening Exercises in Knee Osteoarthritis, a randomized controlled trial. And just realize the glute exercises they got were those sideways exercises, the ones that I showed that I don't prefer. They're better than nothing, but I'd rather you just go into direct hip extension like that donkey kick that I was showing. What they found was that quads and glute exercises did better than those that just did quads. Not surprising for me. Now, there are no research studies that I know of. Maybe you guys have found them. I would love for you to share them with me, that just tested glute only exercises versus quads only exercises, or glute only exercises versus glutes plus quads. And I think that a lot of healthcare researchers out there are afraid to do it because they're going against the grain. They're going against the mainstream medical profession. I think their colleagues are telling them, no, you have to include quads in there somewhere because that's the standard. That's what we should all be doing. And so they're afraid to research it, I think. They don't think it'll get funded or approved, or I don't know the details of that. I'm not into the research too much because obviously I hang out on the fringes, on the black sheep in the medical community. But this is already showing to be helpful, even though it's poor quality glute exercises, in my opinion. So I take it to the extreme. Let's do direct hip extension. I have people do bridges, those donkey kicks. And before we even get there, a key factor that wasn't discussed in this study is, could those people doing these exercises even contract their glutes apart from their thighs? Because you guys are all struggling with that here. Once some of you people that meet me for the first time here on YouTube or Facebook, Instagram, wherever you're watching me, and you're sitting here trying to tighten your glutes, you're like, oh yeah, mine don't work. When you go do bridges with your therapist, what are you using to do your bridge exercise? It should be glutes, but you're probably compensating with hamstrings or back muscles. You're using other muscles by default. Your body just says, we have to pick up our hips. We have to kick our leg back. However possible, we will just figure it out. But if you constrain yourself to using the glutes, the hip extensors, then you're going to decrease forces in the knee, decrease quad tension, and decrease all that pressure going through your poor cartilage and your meniscus and your ACL, your chondromalacia patella on the back of your kneecap. So super important, in my opinion, to make sure you get the glutes better active better. Let me say that better. It's super important for you to get your glutes activating better than ever before in your life to fix your knee pain. All right, last one here, number 5. Let me make sure I got this right. Oh yeah, this is the idea of co-contraction. So the study isn't directly talking about co-contraction, but this is what I'm extrapolating from it, co-contraction. I was mentioning it, answering some comments earlier. What they found is in this study, the study is called Knee Osteoarthritis Alters Peri-articular knee muscle strategies during gait. Big fancy words for your knee doesn't behave the same way if you have knee arthritis when you walk. And what they found in the research is that your knee muscles, oops, blending my letters here. Your knee muscles act different when your knee is injured. When knee is injured. And it kind of makes sense, right? Like you've all had knee pain probably. If you're on here, you all had knee pain at some point in your life. And when it hurts to bear weight and use your leg, you limp, you move different. And as a result of that, you use different muscles. One of the muscles that often is affected is your quads, and it might even look weak when your knee is hurt, especially if you have chronic knee pain like with knee arthritis. So what will happen as a result, in order for you to continue to walk and get around, because you have to, right? You have to move, you have to go places, you have to go feed yourself, go to the bathroom, take care of things, work, take care of people. There's things you have to do. So you inevitably begin to use other muscles in addition to the main one that you're supposed to be using. Or if you have a weakness, if your weakness shows up, you start to use another muscle completely. Your body just figures this out. This is what I would call co-contraction. There's a version of it. It's a version of co-contraction. It can get more complicated, but at the most basic way to explain this is all the muscles will work, or many muscles will work around a joint in order to complete a task. This is what I was talking about with the, was it Raka, who had the knee pain on the inside of the knee? Rekha? I'm sorry if I'm mispronouncing your name. But when you're doing something aggressively, like she was probably activating her glutes very aggressively to the maximum, while trying to do that sit-up motion. So all the other muscles around the thigh also activated. And if you think about the way that a healthcare professional, like a physical therapist, might have you do exercises for your knee arthritis or for your patellofemoral pain syndrome, your chondromalacia patella, or your meniscus injury, all of which you're trying to avoid surgery for, you might be going very aggressively to finish all the reps and sets and against the resistance they're giving you, like with the exercise band or with the weights or whatever it is. And you're just doing it just to check off that I did 10 reps or 30 reps or whatever it is at the weight they told me to do it. But what is the quality of the exercise that you just did? Did you actually target the muscle that you intended to use? And if you take it a step back even before that, is your poor knee joint even ready to take the increased tension in all your joint, in all the structures of the joint? Because if your knee is very painful right now, you should probably be offloading. What I mean by offloading is using a device like this. Instead of trying to do quad extensions, knee exercises, even a glute exercise. If your knee's so painful and injured right now, you should probably take the pressure off your leg and walk around with a walker or some crutches. We still have our other crutch borrowed out, but you should take some pressure off the leg and get around without aggravating your knee more before you even exercise. And this is something else that's against mainstream medicine. Let the body heal. It's aggravated because there's too much irritation to the area. There's too much irritation because of that increased pressure, and you're trying to force your way through exercise? No, back off. We talk about it in our program. For those of you guys that haven't seen this before, this is the 4 phases drawn out by the criteria that put you in each phase according to the symptoms. And before we even look at the symptoms here, I'll explain this to you here. Phase 1 is when you're very severely in pain, you have more severe symptoms. Phase 2 is a little bit better. Phase 3 is even better. And phase 4 is where you're feeling great again. In phase 1, you have swelling 4 to 7 days a week, pain at night or pain during the day 4 to 7 days a week. You can't tolerate being on your feet for more than 10 minutes. And then if none of those things bother you, you might just have glutes. Let me zoom in on this for you here. Your glutes cannot flex or tighten. Other muscles flex instead. So you qualify to be in phase 1 if you just have one of these things that I listed. Even if you have zero pain, but you can't tighten your glutes today, you start here. And the way my program is set up is there's certain exercises, certain treatments that you do here. And the ones that are in these phases over here, you don't do those yet because it's going to make you worse. We have squats in here. We have walking and doing cardio exercise and weightlifting. We have some basic exercises that you shouldn't be doing until phase 2, because if you're in phase 1, you're gonna anger your knee joint. Don't do it yet until you qualify to be in the next phase. Then do these exercises and so forth. It's a principle here. You're gonna co-contract. You're gonna be acting on an injured joint. We need to make sure it calms down so that you can properly tolerate the exercises that you need to do according to the phase of healing that you're in. And this is not talked about by medical professionals. They just put you through a list of exercises because you have a knee injury. And there isn't a whole lot of thought to it because they're just regurgitating to you what they got taught in school, what their mentors taught them. And there's not a whole lot of accountability usually on their improvement because they get paid no matter what, as long as you show up. If you got better or worse isn't usually the reason why they get paid, which I think it's a whole other conversation. I think they should get paid if you get better. That's the world I live in. We have people join our program, and if they don't like our program, they leave and they don't pay us. And that's the pressure I live in. And I like that. I think that's doing right by everybody. All right, with that, let's end the discussion here. Let's go to comments. Let's see what you guys have left in the comments here for me to answer. We have Mimi that says, night pain keeping me in phase 1. Yeah, and that's important. Some people don't have pain during the day, but when it's nighttime, they cannot sleep. And it's really crucial because you heal most when you sleep. And some of you guys that are very active and you have like a higher pain tolerance. Pain tolerance is subjective, but there's people that don't feel much during the day because they're so focused on things they're doing. But when nighttime comes and the lights leave, the sounds leave, it gets quiet at home, and you're left with just your swollen knee and your painful knee, won't let you sleep sometimes. And so some activities during the day need to be modified, offloading very often, the massage gun, so that you can have better sleep at night, and that'll set you up for better exercises to fix the root problem. Cindy Knight over in Odessa, she says, for osteoarthritis in the hips, should I only work my glutes, just tightening while standing, before moving on to any of the next exercises? Cindy, if you cannot confidently, consistently flex your glutes, apart from thigh muscles or other muscles, could be your back too. If you cannot do that, then that's where you should be, is practicing flexing your glutes. Then I would practice flexing right and left independently without other muscles firing. But once you've achieved that, once you feel like you can confidently flex your glutes, then there's other exercises to do. Now you've got to strengthen those muscles in harder exercises. So it's a progression. Usually in phase 1 and part of phase 2, you're just flexing the muscle to get it to improve. But definitely by the time you get into phase 3, some of phase 2, we're doing some more aggressive exercise. But now we have confidence that you're going to consistently get a good glute contraction when you do those harder exercises. So you'll be ready for it. Hope that answers your question, Cindy. I'll call you Crow. Crow says, I need to exercise, and walking has always been my exercise of choice. I've heard that you shouldn't walk when trying to heal the knee. Is stationary bike acceptable? This is tough. When you say I need to exercise, there's different reasons for that. If you're like me, like I just feel good when I exercise, and I go a little nuts if I can't exercise. I just love to do it. But if I'm dealing with an injury, if you're dealing with an injury, then it would be advisable to not exercise during that time and find something else to entertain your mind or whatever it is. Now, there might be other reasons why you need to exercise, but here's the thing. If you hurt your knee with walking, it doesn't make sense to go walk. Now, biking, you could also be hurting your knee, especially if you haven't figured out how to use your glutes. So what you have to do right now, and this is where you can kind of get around the I need to exercise argument, is you should be flexing your glutes every hour of the day, even every 30 minutes. I talk about it in phase 1 of our program, which, by the way, phase 1 of the knee arthritis recovery program is free out there. Those of you guys that are thinking about joining our program, I highly recommend you go to our website right here. We put it up for you, and you'll see where you can click, and it'll say free phase 1. That's what our website looks right there. Once you get to the videos right there, there's a list of videos. Just hit that play button, and you can start watching the videos. You can scroll through the videos there. There's about a dozen videos that are all the phase 1 videos from our paid program, so you can start trying it out now and determine if it's right for you. You can learn a little bit more about the program, and if it's right, you can fill in the application that you saw there, and you can request to get access to the rest of the program. That way you can start now. And in there, I talk about when it's right to cycle or walk. And I'll tell you right now, just to answer your comments, is I don't think you should be biking either unless you have confidence that when you bike, you're using your glutes. But if you just go cycle, because that's what mainstream medicine says. Oh, knee pain? Cycle because it's low impact. They always say it's low impact. But what muscles are you burning when you cycle? If you feel your thighs on fire, they're the ones getting the workout, you're actually feeding into the problem. And I wouldn't be cycling, even though it might feel good on your knees today, because I've seen people cycling for weeks, months, never having any knee pain, but they're getting a heck of a quad workout. And then after they hit a certain threshold, their knees really bother them because they've created a worse muscle imbalance by strengthening their thighs. And they miss using their glutes on the cycling. So be careful there. Bells says, I can't do tailgate swings anymore after 3 months because it hurts me a little behind the knee. What can I do? That's a good question. You could go with glute activation, try to tighten your glutes. But even then, I would be a little concerned because before leaving tailgate swings completely, I would ask some questions here. How aggressive are you with them? Because it should be light. Let me show you what tailgate swings look like and what aggressive versus non-aggressive would be. So tailgate swings are simple. You just sit somewhere where your feet dangle a bit, get a computer chair and raise it up, sit on some pillows if you don't have anywhere in the house that's low enough, sit on some books or find something you could elevate your seat with. And then you're just going to swing your legs. You can swing them together or individually, opposites like this. The idea is just to get some easy motion in your legs. Now, what I'm not doing here is aggressive swinging. That's not necessary. You should not get tired doing this. It should be mild. And you could bring it down to even just barely moving a leg back and forth like this. The idea is to circulate the fluid inside the knee joint to stimulate healing of the knee joint so that it's not so inflamed. This helps set you up for tolerating more exercise later. But tailgate swings alone aren't going to fix the whole problem. You might need to be offloading with this. Because if you're doing tailgate swings, but then you're going to go walk for 20, 30 minutes and flaring up your knee again, that might be what's setting off your pain. I would go look at offloading. I would go look at trying to activate your glutes. I would go look at the massage gun too, because maybe your quad muscles are really tight and releasing them with the massage gun can give you some temporary relief that'll make you feel better, help you sleep at night, help you feel better during the day. If all those things aren't working for you, then I would say you probably need to be talking to the doctor. Potentially you're a person that might need to have a knee replacement. But I would go thoroughly apply offloading, thoroughly get the massage gun on your thigh so that you can release the thigh muscles and make sure that you're not overdoing it on tailgate swings. Activate the glutes as well. Try all that first. Hope that helps you, Bells. Mimi says, last week I asked about EMS jumpstart atrophy glute. Oh yeah, the electrical stimulation. I just started, but I think that it's helping. My struggle is lateral thigh and calf pain during sleep. Yeah. So I remember this comment. You were asking about using the electrical stimulation machine on the glute muscles to help activate it. And I give you some specifics on how to use it. Thank you for updating me on that. Yeah, it does work. Just realize that it's not a good long-term solution. Like it's just to kickstart the glute activation. But as soon as you feel like you're able to get better activation, then it's a matter of you figuring this out. I mean, for some people, it's really hard. And if you ever, we homeschool my 4 kids and we've taught them all to read. And when they're first starting out on reading letter sounds, if you think back to, if you can remember when you went through that, or you've seen family members, kids in your family go through that, it is challenging to begin to learn to read, or think about like driving or cooking, some basic task that you learned that you struggled with. It might be a challenge. It's the same thing with glute activation for some people, and it is completely okay. So Mimi, you're on the right track. I'm glad you got the EMS machine. I love this example for everybody else that's really struggling out there. This might be a good alternative for you. Who we have next? Dana. Can I ever get to running, jumping, and playing badminton, with no cartilage left in my knees, with only exercises? Please be honest. I almost die even climbing single stair right now. I wouldn't lie. It's hard for me to tell you with certainty based on just this comment. Like, I don't know. To be honest, I don't know your full story. I don't know if you're morbidly obese or really thin. I don't know what your habits are. Like, what I'm saying is there are a lot of factors that go into being able to give you a clear yes or no. But what I think you can have confidence in is there's a lot of people that have done it. And we're not even talking arthritis here. You're saying that you have no cartilage left. So it could be arthritis, could be chondromalacia patella. When you say you have no cartilage left, that's the part that I hang on. Because who told you that? And what imaging was done to determine that? Because if it was an x-ray, which is usually the case, a doctor will do an x-ray and they'll put it up on the screen for you, the light box, whatever they're using, and they'll say, look, your joint's bone on bone, which means you have no cartilage left. And if it's just an x-ray can only see bone. It cannot see cartilage. And if you have increased forces through your knee because of that quad strength, if your knee was bent during the x-ray, if you have increased quad tension because you have that muscle imbalance that I always talk about, it's highly possible that you do have cartilage left. It's just smashed. And when they took that x-ray picture of your knee, they took it with your knee cartilage smashed. And so it appears like there's no cartilage left. But if you fix the imbalance by getting stronger glutes and quick co-contracting, you might have the appearance of more cartilage in your joint. So I'm a questioner. I question, what does the x-ray really tell us? And that doctor's assumption, they're assuming that you have no cartilage left. If it was just an x-ray and they put that in your head and you know, if that's the authority that you have to go off your knee pain, I get it. That's what the doctor told you, but you're here learning. So I hope you can answer your own question with this. I can't answer it for you. I've seen a lot of people improve. I've seen a lot of people fix the imbalance and unsquash their knee cartilage and get back to being very active, including running, climbing, playing sports, even dynamic sports like badminton. I've seen it happen all the time. Remains to be determined for you. All right, next question here. Oh, can I use resistance bands for glute exercises? Same person here. Can I use resistance bands for exercises? Let me answer that. If you feel like you're targeting the right muscle, that's what it comes down to. There is no big magic between body weight exercises, resistance bands, weights, like free weights or cable weights. There's all different kinds of exercises. The main take-home message is, did you feel it in your glutes? And did you best isolate the glutes? Did you bias the glutes? It's okay if you feel it in some other muscles, but can you honestly tell yourself after completing an exercise that, whew, I felt it in my glutes mostly? If you did, whether it's resistance bands or whatever other resistance you want to use, then you're on the right track. Which are exercises for starters? Oh, we have tons of videos on that. Go look through our library of videos. You got to do some research and learning here. I'm spoon feeding you a lot of information, which that's what I'm here for today. We have other people asking questions too, though, but you got to do research. You got to look this up. And I have a lot of videos. I have built programs that I built. It's a learning thing. This is an educational program. I kind of have hip pain at 30 years due to chondro grade 4 on the right knee. Does that mean hip arthritis? It depends on what the x-ray says as far as hip arthritis. You probably have the muscle imbalance that sets up all these knee problems as well as hip pain. So that's, I think, the best news for you here is if you fix the muscle imbalance, you're probably going to make your knee better and your hip better, and you're probably going to get back to being very active. But it's a matter of you slowing down and learning the material and wrestling with what other doctors are telling you and realizing that mainstream medicine does not know how to fix muscle imbalances. And if that's what you truly have, you probably shouldn't be listening to the doctors out there telling you to do quad strengthening and telling you probably don't have any cartilage left when you probably do. You got to see for yourself. Good questions there. Breathing space. For those of you considering, just make the jump. Start with 1 or 2 and do them gently every hour. Set a timer on your phone. You will see a difference in 2 weeks max. Yeah, I love this comment because that's, I think, where a lot of people are, whether like Donna, I think Donna was asking, should I do this? Should I do that? You're pinning me down on giving you like a yes or no answer, which I get. Like you're desperate, potentially. You're looking for answers to your questions. But at the end of the day, you got to try stuff. You got to put this to the test. I tell everybody, like, I'm not for everybody, but the way that you can know is to try it and try it well. Don't just say, well, I kind of did it a little bit. Say, no, I did it like I went to the free phase 1 for the knee program. We have a free phase 1 for the hip arthritis recovery program too, for those of you guys with hip issues, with hip arthritis. And try it out. We have tons of videos on YouTube describing different exercises and ways of thinking about this. You've got to go through the learning curve here. There is a learning curve. There's no magic exercise that's going to solve your issue. It's a series of exercises that are essentially a process to fix your problem. I love your breathing space. All right, we got multiple comments here connected. Glorianne says, that's interesting. I didn't know the x-ray doesn't see cartilage. Yeah, it doesn't. It only sees bones. How can they stand there and say you're bone on bone? How absurd. Yeah, it's there. Like I've said always, and I'll stick to it. Your medical professionals out there are doing the best they can with what they know. And they're regurgitating what they learned in school and what they got from mentors. That's what they know to you. And it's rare that they question it. It's the few that actually question and say, well, wait a second. X-rays only see bone, not cartilage. So if the bones are touching, could it be squashed cartilage? They just assume that it's lost cartilage. And I have to ask that question, because how is it? It happens all the time. How is it that someone with grade 4, which is the most severe arthritis, bone-on-bone arthritis, very painful, they might be swollen, unable to walk, but then they start going through our program as what happens, like Emmett earlier. They get told they should have had surgery already. How are they getting back to being active again and living their life without pain, even though they had no cartilage apparently? I think it was just squashed cartilage and it wasn't given room to heal. But once we fix the imbalance, then it gets room to heal and you can have improvements that last a long time. I love it. Al, I'll just call you Al, Allure. Hi, I am in 3rd stage knee arthritis and am 40. So I got stem cell injections 2 weeks back. Can you tell me from where should I start with what exercises and activities? I would start going to our phase 1 of the knee arthritis recovery program. Go to our website. There's the website right there. Once you load the website, you'll see Start Now for the knee arthritis recovery program, and go through all the videos there. There's a video player. You'll see a little video, see a picture of me and a play button nearby somewhere. Hit the play button, and then you'll scroll through the other videos, and you'll see a bunch of other videos. Start going through all those videos. That would be the first place to start. Educate yourself. You have to educate yourself. Hope that helps you there. C. Reynolds says, what do you think about the vibration plate? Oh, good question. So the vibration plate is it's this platform you usually stand on, and it vibrates at a very high frequency. And then when you stand on it, it makes your whole body vibrate, and it'll usually tickle your nose. And the idea is that I'm not 100% certain on the idea, but that you're supposed to get better muscle activation or blood flow, something like that. But I would always go back to answering the question of, does it make your glutes work better? Because that's what's necessary to take pressure and tension off your knee joint structures, your MCL, your cartilage, your meniscus, all that stuff. If the vibration plate does not make your glutes notably more tired, it's not directly fixing the root problem. Now, if you feel better in your knees right after you get off of it, or whatever body part you're looking at treating, your hips maybe, then great. But its purpose is short term. And that's okay. It's better than taking pain medications. It's better than getting some procedure done that might not be reversible, like a knee replacement. So I'm okay with it. I'm not against it. I just don't want you guys going out there and buying some of them are pricey, a vibration plate, hoping it's going to fix your arthritis problem I don't think that's the intent. I think the intent is short-term pain relief that's non-medicinal, non-surgical, no interventions, no extreme interventions. What's the word I'm looking? Invasiveness. No, it's not invasive. So give it a shot if you want, but don't count on it to fix you. JS says, how would you use isometric exercises to strengthen and to stretch out the quads? Which ones and what duration? Oh, I love this question. I don't say the word isometric a lot, but we do a lot of isometric exercises, especially at the beginning. What that means, isometric means you're just contracting, but without moving. So like if I'm doing a bicep isometric contraction, it'd be right here. Like my bicep is flexed, it's moving. I'm sorry, it's not moving, it's activated, but I'm not bending or stretching out my elbow. If I bend it and it's activated, it's a concentric contraction. If I'm straightening it out, but I'm still activating it, it's, excuse me, it's eccentric. But Isometric means it's isolated. It's just staying put. I teach isometric exercises for the glutes all the time. Like I was teaching this one here, that donkey kick. I did a standing version and a kneeling version, but I'll tell people to hold here with the intent of activating this muscle. The reason is because I want the nerve signals, because you're thinking about tightening the muscle. I want that signal to be traveling down to your muscle, and then for you to get the feedback where you feel the muscle burn, because that enhances the connection so that you can more confidently fire the muscle. Plus, that's just one benefit, is the neural connection, the neuromuscular connection. The second benefit is that the muscle itself is made out of a bunch of cells. And if you have an underperforming muscle, like glutes are very often with knee arthritis and different kinds of knee pain, you wake up more cells. Muscle cells are lazy. If you don't make them work, they get weak fast. And so when you don't have an active glute muscle and you make it work, there's only some cells that are working. A certain percentage of the cells are actually working, but the longer you hold the contraction, you keep sending that signal to the muscles that are working start to nudge their buddies that are asleep and say, hey, wake up, they're making us work now. You got to help me out. And then you get a more efficient contraction. You start to get 100% of the muscle cells working. And that's very important before going to the concentric and eccentric exercises. Because if you go straight into leg lifts like this, where you're just picking up and you've never really focused on using your glute muscles, that's where these lazy cells in your glutes say, I can't do this. And then it just tells the neighbor, hey, hamstring, help me out. And then it turns into a hamstring exercise and you miss the glutes. But if you start with just forcing your glute to work and you're saying, come on, all of you cells in there, wake up. Come on, turn the toe out, get the knee out. All of you guys get up. And then you do that for a period of time. And then you start to feel the whole thing working. Then when you go do reps, these muscles are saying, all right, I'm awake, I'm ready, I'm going to help. And hamstring doesn't have to help. You get a much more efficient exercise when you start with isometrics to wake up the muscle and then carry it over into the reps, concentric and eccentric. Hope that helps you out, JS. Teresa Martinez says, hi, Dr. David. I live with pain every day in my right hip and knee. Some days are worse than others. Also, a lot of pain on both thumbs and base of my hands. I'm so sorry. That's tough. I hope you can offload, but offloading is going to be tough with your hands. They do have walkers that you rest your forearms on. That might be a better option for you to get some relief on your hip and knee. For your hands, you might need to start doing some hand exercises. We actually have a hand arthritis recovery program, and I think it's a pretty solid program, by the way. It doesn't get a whole lot of popularity. We don't have a ton of videos to promote it, but we have a whole playlist of hand arthritis videos you could check out for free on our YouTube channel as well. So I would go start there. And then of course we've got videos for hip and knee arthritis and other kinds of hip pain and knee pain too. So hopefully that helps you out, Teresa. Catherine says, how do I stop my bone-on-bone knee from hyperextending all the time? This has been happening since my opposite hip groin have gotten worse. Will this exercise help? So hyperextending just means that it's straightening out too far. I cannot hyperextend. I'm so stiff in my joints. But if this is knee extension, hyperextension would mean it's like going backwards. Some people that are more flexible can do that. Usually women can do it more. Some men can do it too. But the number one way to stop hyperextending a knee is to become very conscious of it. That's number one. Just pay attention and stop locking out your knee joints. You have to keep your knees just subtly bent. And it's going to feel like you're bending them a lot at the beginning, but as you get used to it, you have to just get used to, let me show you. Like if you tend to stand and when you stand, you lock out your knees, you have to get used to just slightly bending them and standing like this. It's going to feel like you're standing like this, but you're just slightly bent. And that's how it should normally be. Then step two is when you stand, you have to think about activating your glutes. Because actually, if you activate your glutes, watch, I'll lock out my knees. When you lock out your knees, you by default activate the quads because these muscles have to activate to make your knees tighten up. But when you tighten the glutes, you shut off the quads a bit and it makes you want to bend your knees. and it actually begins to feel more manageable. Like you can stand better with your glutes active. So do glute standing, not 100% glute activation, just some mild glute activation to get your glutes involved in standing. And that helps the hips and the knees. Mimi's back says, for me, 1 round on my vibration plate set me back for a week with awful hip pain. My experience may be unique and not common. I've seen different things. I've seen people swear by the vibration plate and say that it's the best thing they ever did as far as pain relief, and they never have to take pain medication. And then I've seen situations like yours, Mimi, where it's not that great. So at least you know now. Ha says, does shockwave therapy help? I don't know. Some people say it helps. Some people say it doesn't. It's like the vibration plate in my mind. If you're looking to heal from a knee pain problem, like fix it for the long term, I don't think it's a solution for the long term. I think it's a great short-term solution to avoid medications, injections, and things like that, visiting the doctor. But it's not making your glutes stronger. It's not teaching you to move better. So I'm not against it. Like with the vibration plate, you can try it. You can see if it helps you out. Just know that it's not fixing the muscle imbalance. It's not fixing the long-term problem. Robin says, what about ortho laser? Same boat. It's in the same laser treatments. Like for pain, there's red light therapy. That's another one that's kind of popular out there. Shockwave's been a big one. Ultrasound was like shockwave back in the 90s, still around in the 2000s. What's the other one? The electrical stimulation. All those treatments, they call them treatment modalities in the physical therapy world and the healthcare world. They are not fixing root problems. They are just helping with pain relief in the short term. It's okay to use them. And I like that they're not medications, so the side effects of them are very low to nothing. You just have to understand that you can't go to a shockwave treatment. You can't buy a laser treatment for home, like a red light treatment, and expect it to fix your arthritis or your chondromalacia patella or your torn meniscus or your hip labrum tear, hip arthritis, even bursitis. The reason bursitis happens is because there's too much tension through the bursa, or tendonitis, same thing, too much tension through the tendon. But in order to fix the tensions and the pressures, you have to fix the imbalance, and light treatments and ultrasound treatments, shockwave treatments don't do that. But it's short-term help. All right, Amanda says, no question. Just want to say your content and output has transformed my knees. Thanks for it all. Aw, thank you, Amanda. I love that. I think that's my favorite comment of the day, Amanda. Thank you so much. You get a gold star. A few of them. We got some more here. Meniscus questions. Who's got a meniscus problem? It's time to go outside. I love that. It says, I have plantar fasciitis and tore my meniscus because of it. How do I start rehabbing my meniscus if I can't even plant my feet properly? Oof. And then Jean here says, hi, doctor. 4 months ago, I injured my meniscus and the doctor said I need keyhole surgery. After I saw your video, I started the exercises. I get better. If it is damaged, can I get better? Great questions. So regarding the plantar fasciitis, usually plantar fasciitis is a nerve problem stemming from the sciatic nerve. I have consistently seen that. And people get diagnosed with plantar fasciitis all the time. And do I have my foot here? Yeah, I got the foot. They get told, here's the foot. So here's the foot. There's the bottom of the foot. The plantar fascia attaches right here on this red spot. That's where the red indicates that's where the attachment site is. And then it goes up and fans out towards the toes. It's this thick tendon or ligament-like structure it's really tough. But what isn't told usually is that on the inside of the ankle, there's a nerve that comes right here, and that nerve innervates the bottom of the foot. And there's a little branch that goes right here. It's called the first branch of the plantar nerve, and it goes right under the plantar fascia at the insertion of the plantar fascia. And that's usually what gets irritated and painful in people. And doing stretches as is often told, as medical professionals often tell people to do for plantar fascia, actually worsens nerve problems. So in this case, it's time to go outside. I would not worry about being on your feet. I would actually worry about doing glute exercises and ab exercises and treat this like a sciatica problem. Plus, that's going to help your meniscus issue anyway, fixing the root muscle imbalances. Go to our sciatica videos, literally. I have plantar fasciitis videos that talk more in depth about this being a nerve problem. I would Google El Paso Manual Physical Therapy, plantar fasciitis, and you'll find the videos and you can start getting help there. Now, as far as the meniscus, go to the second comment here, please, if you can. Even if you have a meniscus tear, let me show you on the knee model here. So this bluish thing here is the meniscus right there. And if it is torn, let me get everything out of the way. They're C-cups. They're like cup-shaped structures. They kind of are cup-shaped like this. And you have two, one on the inside, one on the outside of your knee. If there is a little tear, a fray, if you can still bend and straighten out your knee decently well, and you're not getting consistent locking, like where your knee can't bend or like it's stiff, then you have an excellent chance at rehabilitating your knee without having surgery by fixing the root muscle imbalance, by fixing the glute strength usually and the foot strength, the toe strength. That will decrease the pressures through your knee, the forces in your knee, and take pressure off the meniscus. And you can live with a tear in your meniscus your whole life. And as long as you keep the muscle imbalances correct, the muscles are in the right balance, you probably won't even feel like you have a knee problem. So many people, I think, are told they have a meniscus tear because they have an injury, they have increased knee pain, and they probably had that tear a long, long time ago, and it's not really the source of their pain, it's the muscle imbalance that's putting pressures to their joint. But because the tear's there, the doctor will blame the pain on the tear. And it may not even be the source of pain. And then just to top it off even more, there's people that have a tear, have knee pain, get told, off the MRI that they have the tear, get suggested they should have surgery to address the meniscus tear. They go through our knee meniscus program, or even those people that are in our arthritis program that go through the arthritis recovery program, and they end up with zero pain afterwards, despite the tear being there. Whether it heals or it's just there indefinitely, we don't know. But if you're feeling better and you're doing better, who cares? So you can definitely get better. All right, Bells says, if I can't do tailgate swings, can I do heel slides in bed? Thank you so much. I'm not a fan of the heel slides. And here's why, is what I mean by heel slides, just so that everybody's on the same page with us here. A heel slide is where you lie down, usually in bed, and you take off your shoe, so it's just your sock, and you're sliding your leg this way and just bending your knee. That bit of friction that your heel gets pulling on the table causes your hamstring to work, which feeds into the imbalance, because I would rather you just freely move like this. This does not make my hamstring work. Very, very little of anything. You could minimize it to almost a tiny bit of motion. This feels like nothing. I'm moving 6 inches back and forth. You can cut it down to even just 3 inches if you want. You can make it very, very low activity. But the heel slide will activate your muscles, and I'm not a fan of that. Reading space. I'm doing something wrong standing. It hurts my lower back. Usually it's that you don't have enough ab activation. So I would look at your ab strength. Are you activating your abs when you're standing? Because if you're trying to do some exercise in standing, or even just standing around, and you're not conscious of using your abs, you're going to by default use your back. That's the muscle imbalance that happens for a lot of people with back pain. There's no weak lower abs, over dominant back muscles. Robin says, can you still have leveled hips with a bow leg due to collapsed knee from arthroscopic surgeries? Can you still have leveled hips with a bow leg due to collapsed knee from... Okay, so what I'm understanding then, Robin, is you have a knee that's like falling in. That's what you mean by collapse. Can your hips be level? Yeah, technically, because you can have a compensation where if your knee collapses in, it's going to theoretically make this leg shorter, which is going to dip this hip down, but you can have your pelvis on this side shift and kind of even it out as a compensation. You can correct that as far as the pelvis shift, but the knee collapse inwards, I think it's, so there's two things. I've not seen somebody correct a knee that's shifted in, but I don't think a lot of people have done it. I talk about this brace called an unloader brace for the knee that shoves your knee outwards. I don't have it with me here, but I've talked about it in many videos. And you can adjust it with a little wrench, a little Allen tool, a hex wrench, and you can make the brace shove your knee outwards. And just like people wear braces in their teeth to rearrange their teeth, I think you can wear this brace on your knee to rearrange the position of your knee. The thing is, there's no protocol on this. There's no studies on this. It's a very new thing, but I would love for people to try it out and see. I mean, what have you got to lose? Go have surgery instead. She said it's shifted. Oh, it's a bowed leg. Yeah, it's the same procedure, whether it's shifted in or out. It's the same idea, though. If your leg's bowing out, it's going to make this leg shorter because your leg's longest when it's all stacked straight. As soon as it starts to bow in or bow outwards, I can't do it because I don't have the deformity. It begins to shorten the space between your hip joint and your foot. And so getting that brace to shove your knee inwards to get the better alignment would be ideal so you can get the proper length through your leg. Julie Parker says, heel slides is one of my exercises I do twice a day, thinking it will help increase my ability to bend the knee. So that won't work. No, Julie, if you have stiffness in your knee and you find that the heel slides do increase your knee bend, then I would do it. What I'm talking about is if you have high pain in your knee and you're trying to do the heel slides in lieu or to replace the tailgate swings, if your goal is to decrease pain, not increase motion, then I would do the tailgate swings. But if your goal is to increase motion, heel slides could be an option. But I would not fight to increase motion if you're in a lot of pain, because it's very possible that you might be in a lot of pain because of swelling, irritation of the joint. And if you're trying to force more motion, when you bend the knee more, you're going to compress the joint and increase those forces in the joint and further irritate it. So I would not be doing heel slides if that's the case. Breathing Space says I was referring to donkey kicks.
About her lower back hurting.
Oh, on the donkey kicks, lower back in standing. Got it. So you're saying that doing donkey kicks like this makes you get lower back pain. Yeah, so I would think about sucking in the abs. If you can zoom in on my back a little bit more or come up. Because what a lot of people will do is they'll stick their bottom out like this, and you can see the curve in my back right here. You want to flatten out that back by sucking in those lower abs. I'm like right here where my hand is on the front. I'm trying to bring those muscles in and tighten them. And this is the starting position here for the donkey kicks. Holding my abs in. You don't have to have your hand here, but just I'm doing it to show you. But then I would hold on to the surface at whatever, table, chair, furniture, whatever you're at, sucking in the abs the whole time, and then think about bringing your leg back. But see how I brought my leg back and my back didn't really move? My back didn't arch more? Because when you arch more, you give up the abs here. The abs stop activating. But when you suck in the abs, then my back flattens as I move my hip back. And so a lot of people think, well, I can move my leg higher if I just let my back go as far as it'll go. But the point is not to move your leg as high as possible or far back as possible. It's to make the glute tire out, to fatigue it without giving up your back position, because then you'll run into some back problems. Hope that helps your breathing space. Caroline Shipsey said, I've just had x-rays, which are bone on bone. They advised surgery, but I'm doing Dr. David's exercises and now the course. I'm with them all the way. Let's go, Caroline. We got you. Come on in. Let's make sure you get your knees fixed up. All right, last comment of the day. Krabby Cake says, Dr. David, I missed the start of this live. When do you usually go live? Love your teaching method. We are moving it to an hour earlier. We're going to be at 1 p.m. Mountain Time. We're in the Mountain Time zone, so figure out what time zone you're in, and it's that time, 1 p.m. Mountain Time. Guys, thank you so much for joining me here on this live today. We'll see you guys here same time next week, 1 o'clock Mountain Time. Y'all have a wonderful week.